The Oregon Health Authority will send free opioid overdose reversal kits to schools and colleges across the state. Naloxone, often bought under the brand name Narcan, is an easy-to-use nasal spray that can reverse an overdose. It's championed as one of the essential tools to fight back against the escalating fentanyl crisis.
Prevention is the most important thing here, preventing the overdose, making sure that people in schools have access in case a student does overdose on school property.
Tom Jean's a deputy state health officer. He says more than 500 schools, from charter and private schools to public schools, community colleges, and universities, signed up for the free doses within a week, showing high demand.
It's been in the news, everybody's aware of it. So even if a school or school district has not actually had any opioid overdoses on in their schools yet, I think most of them are recognizing the need to be prepared.
OHA will give each school up to 3 kits. Each kit has 8 doses. Health officials recommend putting naloxone near bathrooms, AEDs and first aid equipment, and on buses. Schools will decide where they put it. But there's a key element that's missing. We asked, how will the state know which schools are using naloxone, where and why they're using it, and if they need replacements?
It's a good question. We don't have any reporting requirements in place right now. We're certainly going to be talking to schools and talking to the Department of Education to see how this rollout goes once the kids start, hitting the ground in schools.
Without a reporting system, state officials could miss out on key information showing where the fentanyl crisis is growing or which students are most at risk. As it stands, the Naloxone to Schools plan is a one-time initiative. The state is using $693,000 from a $325 million settlement with opioid manufacturers and pharmaceutical distributors. Naloxone typically expires after 3 years.
If we're getting to the point where schools are running out of naloxone, I think that's a really, potentially bad situation to be in, and I think we need to reevaluate. Again, thankfully, these overdoses on school property are very rare at this point. But even though the numbers are still small, the trends are not in the right direction right now.
Jean said the state plans to distribute the naloxone in 2 to 3 months, sometime early spring.
And I think ultimately we would like to see the numbers of youth overdose deaths going down. And I think we will get there with the help of this naloxone, these naloxone kits.
Evan's here with me now, and it is amazing to me that this drug is so prevalent that we've gotten to this point where schools have to have Narcan, but I guess they do. So what about those reporting requirements, though? They don't seem like they're going to be doing much reporting.
Yeah, it's frustrating, right? Because we've talked about this in Washington when we've covered this here on The Story. Washington doesn't have reporting requirements. We've tracked it through how often schools are voluntarily saying that they're using this, to then look at the number of overdoses in Washington schools, kind of expanding out for that case-by-case basis to the larger mechanism here. Now in Oregon, you're starting now, it would be helpful to have reporting requirements to know where it's being used, why it's being used, what age, maybe areas of the state that it's more prevalent than others, but still really frustrating to me personally that you wouldn't want to track that, because when we get to this, that's part of how you get information of where you can better serve, where the crisis is, what needs to be done in the future, and just a voluntary survey type of thing, or somewhere, hey, send to us whenever you use this, where you use it and why, and then we'll compile it from there, would make a lot of sense in my opinion.
Yeah, and as a parent, I would want to know if Narcan was being used at my kid's school because somebody was overdosing. All right. Thank you, Evan Watson. Great stuff.